I'm Jacqueline.
I'm Adam.
And I'm Jessie, and this is Lateral Epicondylitis.
To understand lateral epicondylitis, or tennis elbow as it is more commonly known, let's check out some backhand anatomy. Your forearm is composed of many muscles that are responsible for the everyday motions of your fingers, wrist, and lower arm. In particular, there are four key forearm muscles: the supinator, the extensor digiti minimi, the extensor digitorum, and the extensor carpi radialis brevis. The extensor muscles can become overloaded when repetitive tasks are performed. Because the tendons are too close in proximity to one another, the added strain will cause the tendons to become inflamed, irritated, and radiate pain associated with tendinopathy. Each of these muscle tendons attach to the same point on your humerus, the lateral epicondyle. If left untreated, pain may be referred from the localized area of the lateral epicondyle down the forearm.
Although tennis elbow is thought of as an issue involving racket sports, many occupational motions can produce this form of tendinopathy. Individuals who work in assembly lines, as well as in construction, are prone to lateral epicondylitis. Tennis elbow is due to cumulative trauma, which can turn into a chronic condition if not taken care of properly. You may first notice this condition after playing a sport or performing an activity and noticing that touching the area slightly below the lateral epicondyle is painful. In later stages of the condition's progression, the pain may occur at the beginning of the activity, but will eventually subside as movement continues. If the condition becomes more severe, the pain may interfere with your daily living activities, such as grasping objects like a door handle.
Post-injury, during the inflammation phase, exercises should be avoided and ice should be applied to the affected area. Anti-inflammatory medication or corticosteroid injections may be used during the short-term healing phase. Some physicians may prescribe a period of time where stretching or strengthening of the affected arm is to be avoided after injecting corticosteroid into the site. However, if the condition is long-standing and reoccurring, anti-inflammatories and corticosteroid injections should be avoided as they can hinder the healing process. The main outcome during this time is pain reduction. To help achieve this, a brace may be used to immobilize the affected arm. Once inflammation and pain are under control, stretching can be started. Here are the ABCs and 1, 2, 3s of a basic treatment plan. A. Analyze your lifestyle and the motions that may be causing tennis elbow. These factors could be internal, like your age, gender, and your anatomy, or external factors, like the frequency of overloading, movement technique, and increasing training demands too quickly. Often it is a combination of these factors. B. Bump out the cause of injury. Having identified the source of your injury, correct it. If you do not change the origin of the issue, no amount of rehabilitative methods will help. C. Correct exercises. Performing the correct exercises during rehabilitation is an important element of the healing process.
This brings us to the 1, 2, 3 portion of our treatment plan. There are 3 phases of rehabilitation. Phase 1, flexibility. The main focus at this time is to begin remobilization. This is attained without re-aggravating the tendons. Stretching can be done during this time as long as it is not contraindicated by steroid injections. Hold the affected arm out in front of you, parallel to the floor with the palm facing downward. Using your opposite hand, gently pull the affected wrist and fingers toward the forearm. Make sure the elbow is extended or straight to ensure the most effective stretch. Hold the stretch for 15 seconds and repeat 3 to 5 sets. Once the stretches can be completed without any pain, you can move on to the strengthening exercises.
Phase 2, strengthening. The next step is to build tendon strength. After stretches can be done pain-free, gradual increases in strengthening should be worked on over a 6-week time frame. This may vary depending on the severity of the condition. It is important to be challenged by the exercises but still remain in a pain-free state. Eccentric loading of the extensor muscles is important during this stage. Weight or resistance progression will depend on pain.
Place the elastic band around the affected fingers and thumb. Hold the affected arm in front of you with the palm facing downward and the elbow extended. Slowly spread fingers and thumb apart, holding for 3 counts. Work your way up to 15 repetitions. Gradually add repetitions in sets. You can progress this exercise with thicker elastic bands. Companies like TheraBand sell elastics that are color-coded for various elastic strengths.
To achieve strength gains, you can perform the wrist extension exercise and progress through different weight repetitions and sets as follows. Sit next to a table at a height that allows for the affected arm to rest comfortably on the surface of the table. Position the wrist at the edge of the table to allow for movement, and place a soup can or 1-pound weight in the affected hand. To perform this exercise, use a smooth and controlled motion to bend the wrist towards the floor and bring it back up towards the ceiling. Repeat this motion 15 times for completion of 1 set. If this is not challenging enough, add additional sets or increase the weight held in the hand. Always bear in mind that significant pain should not occur on the first set of a new resistance. If this occurs, the previous level should be resumed for 3 days.
Phase 3. Activity-specific exercises. After achieving flexibility and strengthening in a pain-free manner, activity-specific exercises should be introduced. In tennis, a poor backhand technique is often the trigger for lateral epicondylitis. Because of this, it is important to relearn proper backhand technique before returning to sport, or else the risk of re-injury is increased dramatically. Be sure to perform an examination of the racket before reintroducing the activity. The racket weight, length, grip width, and string tension should all be considered. These components all play a role in force production and force absorption. First, begin mimicking the motions of the backhand stroke using just the racket for weight. Be sure your wrist stays in a neutral position during the strokes. When this becomes comfortable, progress to practicing the stroke with a foam ball. If no aggravation occurs, introduce a real tennis ball. You can begin to extend the wrist during this time to add spin to the ball when you have no pain during the previous strokes. In some cases, a brace may be worn on the forearm to help support the muscles and tendons when you are returning to regular activities. Finally, be aware of your playing conditions and how it can affect your swing. Outdoor courts such as clay or grass increase the speed of the ball during contact. Weather conditions play a factor as well. If playing in the rain, a wet ball will create more force at the elbow due to the added weight from the water.
In summary, treatment of lateral epicondylitis is as easy as A, B, C, 1, 2, 3. Analyze the causative factors and bump them out to prevent continued or future injury. Perform the correct exercises throughout the rehabilitation phases. The exercises and rehabilitation phases are Phase 1, flexibility. Phase 2, strengthening. Phase 3, activity-specific exercises.
Remember that progression from one exercise to another will depend on your ability to perform each exercise without any pain.
It's over when it's over, ain't it, baby, ain't it? Grips you like a dagger, can't it, baby, can't it? Wish we could do it over, damn it, baby, damn it. We had it in the air, but just couldn't land it. It's the first snap of the last straw, where regrets outlast the alcohol. It's a